The United States spends more on healthcare per person than any country on Earth, $12,500 a year, and it still leaves 25 million people uninsured. Every other wealthy country covers everyone for half the cost. Here's how 4 of them actually do it. Germany uses something called statutory insurance. There are 105 nonprofit funds, called sickness funds, and every German must enroll in one. Your employer splits the premium with you. You can switch funds. They compete on service, not on whether to cover you, because denying coverage is illegal. Japan has employment-based insurance for workers and community insurance for everyone else. The key: the government sets a national fee schedule for every single medical procedure and renegotiates it every 2 years. A doctor visit costs about $3 out of pocket. The Japanese see a doctor 13 times a year on average. Americans go 4 times. Canada runs a single-payer system, but it's actually 13 separate provincial systems. Each province collects taxes and pays hospitals and doctors directly. You show up, you get care, you walk out. No bill, no claim form, no network. Private insurance exists, but only for things like dental and prescriptions that the public system doesn't fully cover. The UK's National Health Service is the most government-run of the 4. The government doesn't just pay for care, it owns the hospitals and employs the doctors directly. It's funded entirely through taxes, free at the point of use. A British citizen can see a doctor, have surgery, give birth, and never see a single bill. Here's what that costs per person per year. The US, $12,500. Germany, $7,000. Japan, $4,800. UK, $3,800. The US spends more than double Germany, which covers everyone, has no prior authorization, and ranks above the US on nearly every health outcome measure. None of these are what people mean when they say socialist medicine. Germany has over 100 competing private-ish insurers. Japan has private hospitals. Canada has private doctors. The UK is the most government-run, and even the UK allows private insurance on top. The common thread isn't government ownership. It's that covering everyone is non-negotiable. And what do you get for spending double? The US ranks last among wealthy nations on life expectancy, maternal mortality, and avoidable deaths. Japan, with its $3 doctor visits and government price controls, has the longest life expectancy in the world at 84. The US sits at 76. That's not a rounding error. That's a policy choice. Every country that built universal coverage did it before a massive private insurance industry existed. The US waited. And by the time the political will showed up, there was a $1 trillion industry with lobbyists, campaign donations, and shareholders, whose entire business model depends on the current system staying exactly as it is. Germany's system looks nothing like Japan's. Japan's looks nothing like Canada's. Canada's looks nothing like the UK's. But all 4 share one principle that the US does not. Coverage is a floor, not a reward. You don't earn it. You don't negotiate for it. You just have it. So if 3 of these 4 countries have private insurers, why don't any of them have prior authorization? Stay tuned and please subscribe. That one's next.